So I want to start by kind of telling a little bit about what inflammation is and how that acts in PCOS. And then, we'll go in the same way. So inflammation is basically your body fighting off something that it thinks is an intruder. So it's your body fighting off to protect itself, right? It shows up in different forms in your body. So what happens is, if you are somebody who has a high amount of processed foods, who has a high amount of foods that don't go well with their gut, what happens in your gut, your intestine, is that there is an imbalance of unhealthy bacteria in comparison to the healthy bacteria as a result of this inflammation. If you're having foods like gluten or dairy and your body is sensitive to these foods, then this is very likely to happen. If you're going to have very high processed foods like maida, so very refined foods, then this could happen to you. It may not happen with all kinds of gluten. It could happen only with refined flour. So there are varying degrees to which this happens. And the way it shows up in the bodies of people is in the forms of migraine headaches, bloating, something called as brain fog. So brain fog is essentially feeling zoned out or tapped out, not having a great sense of orientation with what's happening, and finding it hard to focus. A lot of PCOS persons deal with this without knowing that it's because of their PCOS. So migraines, brain fog, bloating, bowel issues, so having constipation or IBS, irritable bowel syndrome, which is constipation, diarrhea, or both, is highly common in PCOS persons in comparison to healthy population. That's not something we talk about. So all of these things, skin eruptions, if you've been having eczema accompanied by like your entire scalp flaking, something like that. In a lot of people, even joint pains, backaches, these are signs that inflammation is acting up in your body. And it is also a sign that you need to relook at your diet and your stress levels. What this inflammation does is it raises your stress hormone, cortisol. And cortisol, in turn, raises your masculinizing hormones or your androgens. Androgens are the main culprit when we're talking about PCOS. Like, it all boils down to raised androgens. And these androgens, either if it's in your stress gland or your adrenal gland or on your ovaries, these androgens first do the job of saying, no, ovulation ain't happening right now. And that's how you end up with your acne, your hirsutism, and your irregular periods, which are your PCOS symptoms. I think I've explained enough. So I'm going to pass it over to you, Ankita. What are some of the tests that someone with inflammation could look at? Anything that I may have missed out?
As you beautifully explained it, Renuka, the connection between inflammation and stress hormone. So I just want to add that many patients come with a combination of psoriasis and PCOS as well, because psoriasis is a chronic inflammatory disease and which also, comes up at that time when you are experiencing the peak of your PCOS symptoms. Okay, so which is why the both of them are connected. Also, many women many menstruators have experienced that they are getting increase in the severity of their PCOS symptoms just after COVID, because COVID is also an inflammatory disorder, right? So which is why it is important to take into consideration this part also, that inflammatory PCOS exists, and we need to treat the inflammation first to reduce down the cortisol level and then improve your symptoms. Okay. Also, we need to cut down on the triggering activities so as to maintain the regularity of your periods or maybe your hyperandrogenic symptoms, etc. We essentially look out for complete blood count, where we get to know if your white blood cells have increased or not, their neutrophils, lymphocytes, etc. have increased or not, which are suggestive of inflammation. We also go for CRP, which became very popular in after COVID, which is an indicator of inflammation. There are other indicators as well, but these two are more commonly used, and these are indicative that there is some inflammation in your body which is increasing the severity of your PCOS, and we need to look upon that. The cause is to be ruled out and treated accordingly, so that the symptoms will come down to normal again.
I have one follow-up question to that, Ankita. Do you think everyone who's suspecting that they have inflammation in their PCOS, do you think they need to get a CRP done? Are symptoms enough?
Symptoms are enough. You don't need to do your CRP. As I mentioned that in insulin resistance also, your symptoms are more indicative of whatever symptoms you are having. Similarly, if you have correctly defining symptoms of inflammation, it is not necessary that you go for CRP and prove it yourself. Even if the CRP is low, there is an inflammation in the body which is happening and which is increasing your severity, which is why it is not an indicator, or it is not direct go for your PCOS diagnosis or maybe your PCOS treatment. If you have a symptom indicative of inflammatory PCOS, then it is to be treated.
Purvi, what do you have to add in terms of like nutrition and inflammation, because it plays such an important role in literally, like,
Yeah,
we've seen symptoms reversed.
And bloating.
yeah. So
Many
with
of our patients have bloating.
bloating, acne, hair fall, all of these, we do consider them as signs of inflammation. And when like our program people, they ask me what is inflammation, because this is again a word which is thrown around very, very commonly. So just to put it very simply, I tell them that if you have inflammation, it just means that your body is under stress, and your stress can be anything, like working out too much or not working out at all, eating too much, not eating at all. It can also be like stress, like emotional, mental, any kind of stress. And the simplest thing is that our body is not really able to differentiate between these different types of stresses. So when our body is under stress, it is not going to ovulate, because reproduction is never a priority when your body is under stress, and that is how you won't end up getting your period. So once they know that there are so many factors which come under inflammation and which come under stress, because stress is just a word which we very commonly relate with our professional lives or our personal lives. So we don't really understand it. It can be stress in terms of your diet, or it's stress in terms of your physical activity also. So even that needs to be considered. And again, a very common word which has gained popularity is antioxidants and anti-inflammatory foods, and they do really help in reducing your inflammatory markers. But like your favorite antioxidant foods would be all kinds of fruits and vegetables. Okay, the more color on your plate, the more nutrients you are exposing your body to. So try, one simple thing that we tell our program participants is try to eat at least 1 to 2 different vegetables every single day of the week. So even like even if you repeat your vegetable, for like people who stay alone or who do not really have access to different kinds of food, even if you repeat your vegetable for your lunch and dinner, and probably have something else along with your breakfast, you're still exposing yourself to at least 14 to 15 different veggies throughout the week, and at least 3 to 4 different fruits throughout the week. So that is, something that everybody can get started with. And then the rest of the things, like if you are somebody who really needs caffeine, you might want to reduce the amount of caffeine that you have throughout the day just to get yourself started. Probably find better alternatives to your tea or coffee. Again, same thing. Most people don't know that even tea contains a little bit of caffeine, so they're like, we don't drink coffee, so we are fine. We are not really getting any caffeine. But yes, tea also does contain some amount of caffeine, so you really want to learn how to manage your stress better, so you don't really have to rely on tea or coffee for that energy boost or boosting your mood. So that is also one thing that gradually needs to be corrected. And yeah, like avoiding anything which is refined. Okay, so anything like refined grains, refined flours, refined oils, refined sugars. Okay, the more processed it is, the lesser the nutritive value of it is going to be. So one thing that I always say, and probably has become like my favorite line, and everybody relates that line with me, is that try to eat food which is as close to its natural form as possible. So you know that it is going to have, like the maximum amount of nutrients in it.
Yeah, I could not agree more. And in fact, would be, I just feel like when the both of you speak, I just feel like listening, because every single time I pick up two new things to take home, and I do a fair bit of reading myself, but like you guys just read a lot and know a lot, and that's amazing.